So it's the news many of us have been waiting for. The Senate approved the COVID-19 relief package and a omnibus spending bill late last night by a vote of 92-6. Now the bill heads to President Trump's desk for a signature. That's why we're asking, do you think $600 is enough to help Americans right now? It's been months and months since the last bill was passed. So while you vote in our live poll, with an overwhelming majority of people saying no, Cleo, this is not enough. You were in our newsroom. You've got more details on the stimulus deal and what we can expect.
Yeah, Kara, you know, this new COVID-19 relief bill, it's more than 5,500 pages long. And once President Donald Trump signs it, it may be worth skimming through so that you can see how it can benefit you and your family, maybe your small business. Here's what we know when it comes to that stimulus bill and what money will go to what. The direct payments, you will get a $600 stimulus check if you make $75,000 or less. There's $300 allocated in that boost in federal unemployment benefits that will last for about 10 weeks. $300 billion is set aside for small businesses, and billions of dollars has been allocated for vaccine distribution and schools. Now we'll dig into this just a bit more here because the $900 billion package is paired with a $1.4 trillion spending bill that funds the federal government through September. Now a huge chunk of that will go toward helping both small and corporate businesses. And now that the bill passed, Fort Worth-based American Airlines said they will bring back the 19,000 workers furloughed in early October. On Instagram, CEO Doug Parker said workers will get their pay and their benefits retroactive to December 1st. So here's a big deal here because that relief bill also provides $25 billion in emergency rental relief and a 1-month extension on the nationwide eviction moratorium until January 31st. Now, once the funds are dispersed, tenants will be able to apply for aid through state and local relief organizations. So hopefully that helps out. All right, back to those stimulus checks. If you make $75,000 or less, you will receive a $600 check. That is for each adult. If you have a child, you will receive an additional $600. So that means a family of 4 could potentially receive a $2,400 check. Now, it is no secret that these checks have been cut in half from last time around, that $1,200 check that many people receive, and people are talking on social media. It's the reason why this hashtag Let Them Eat Cake started trending. Do a little Google search to see why. It is associated with Maria Antoinette talking down to poor people way back in the day. Do that little Google search there. Some of the comments, this is the top one that's trending from Eli, saying members of Congress got paid $130,000 to spend 9 months arguing about whether we deserve $600. And Kara, as I said, I've been reading those comments. A lot of people saying, listen, I know every dollar counts. It can go towards something, but this is not going to help me much.
Yeah, the comments I'm reading from our viewers on Twitter this morning, they don't sound very good. And the majority of people who voted in our poll, 94%, are saying no. It's just not enough. So as we wait for President Trump to sign the bill, I'm sure many of you are wondering how soon you can expect to see that $600 check. The good news, because the IRS has already done the setup work, the Treasury Secretary said you can expect to receive payments in a few days. Now that money will not go all out at the same time. Those whose bank information is filed with the IRS will likely get the money first, since the money can be directly deposited into your account like last time. So others will receive paper checks or prepaid debit cards in the mail. The first run of checks, very similar, so make sure the IRS has a way to reach you and has your correct information. Last go around, many people received their money within 3 weeks. To give you some perspective, a shot of hope is what it's being called. The Moderna vaccine made its way into North Texas. Healthcare workers at Medical Center Denton were some of the very first to receive the vaccine yesterday. Just yet another step in slowing the spread of the virus. So Tiffany Liu is live this morning in Dallas with the latest on the vaccine and who could be getting the vaccine next.
That's right, Kara. Good morning. Yes, the vaccines are starting to come in, and really this is all just getting started. Now, this week here in Texas, we are expecting more than 620,000 doses to come in. Health officials say that 160,000 are from Pfizer and 460,000 are from Moderna. It is estimated that by the end of December, more than 1 million Texans will receive the vaccine. Governor Greg Abbott is actually set to get his first dose today in Austin. It'll be live streamed at 1:30 this afternoon, and you will continue seeing those leaders and healthcare workers getting that shot in the arm because they want to show that it's safe and effective, and they want to lead by example. So who is next? We know healthcare workers and long-term care residents are first, that is phase 1A of distribution. The Texas Department of State Health Services announced phase 1B. People 65 and older or with certain medical conditions will be able to get the vaccine. Now, patients with cancer, kidney disease, COPD, heart conditions, organ transplant, obesity, pregnancy, sickle cell disease, and type 2 diabetes are at higher risk for severe COVID-19 symptoms. So they are included in that next round, but it is not limited to those conditions. Now, it'll be a few weeks before the second group can actually get started and get vaccinated. So in the meantime, doctors are really urging people to just not let their guards down. Tarrant County reported more than 1,400 cases yesterday, and Dallas County reported more than 1,800, along with 23 additional deaths. And for the first time in Dallas County, there are 1,000 people hospitalized with COVID-19. So while we're hearing a lot of promising news about the vaccine, this is just the beginning, and it's going to take a while before we reach that herd immunity. Back to you, Kara.